function of the center is called agraphia. Graphe, writing. Yeah? Agraphia, when could not take and write something, yeah? For conscious movement. Because here motor, here premotor. And here also coordinated movements of the head, neck. You can turn your eyes and neck simultaneously. Coordination movements of the head and eyes also lie in premotor center. In gyrus postcentralis and lobulus parietalis superior, all sensory pathways come here, but not in fifth, fourth, mainly fourth, third, fourth. Partly they pass even here. When, for example, you hit something and pain you feel, immediately goes to the gyrus postcentralis and precentralis, some portion, which immediately causes movement. Corticospinalis, lateralis, and anterior come. Conscious tract. Gyrus postcentralis is sensory center of the cortex, and lobulus parietalis superior, it is special center of sensation. What sensation? We have pain, temperature here, cortical center here, touch. We can, by touch sensation, it is called palpation or touch sensation. Due to this sensation, it is also a type of sensation, but in this sensation participate not only skin and mucosa and sensory organs, but also participate more deep receptors, proprioceptors, well located proprioceptors in muscles, in tendon, in capsule. Thus, this region is sensory region, this region is motor, this is premotor. In lower frontal gyrus, in posterior part, speech articulation center, speech center, Broca center, gyrus opercularis. In gyrus temporalis superior upper surface, here we have gyrus temporalis transverse, Heschle, by Heschle, Heschle's gyri. Heschle gyri, they are cortical center, auditory center. We can listen all sound waves through the corpus trapezoideum, lemniscus lateralis, through the colliculi inferioris and corpus geniculatum mediale. Impulses from corpus geniculatum mediale come to cortical, subcortical center, come to cortical, and here analyzes these sound waves, and we can understand. And on posterior part of gyrus temporalis superior, here lies auditory center of speech articulation. It is sensory center of the speech. You can listen and understand what you listen. It is auditory center of speech articulation. We have a free center of speech articulation. Here, motor center of speech. Motor aphasia. This patient can perform only some sounds, but it is not speech. They could not perform movements like speech, because speech, it is coordinated movements of all, what mimetic muscle, masticatory muscle, muscles of the tongue, muscles of the suprahyoid, infrahyoid group of muscle of the pharynx, larynx, all together, laryngeal muscles, phonation. All together form under the regulation nervous system. It is motor center. Here, sensory center of speech articulation. You listen and understand what you listen. Sensory aphasia, it is called. Dysfunction of the center is called sensory center of the Wernicke. By outer center of the Wernicke center, when listen but don't understand what say, don't understand. Wernicke center, it is posterior part of gyrus temporalis superior, and here lies, in gyrus angularis, lies reading center of speech. You can read and understand what you read, because near the visual center lies the center of the visual center of reading. Visual center of reading. You can read and understand. It is also connected with speech. Alexia, this function of this center, alexia, read but don't understand. Yeah. And this is center gyrus supramarginalis, which lies on the border of sulcus lateralis. Gyrus supramarginalis, center of the compound coordinated movements, which each person receive along life practice, all compound movement. For example, surgeon can study, perform operation. Pianist can play. Point artist can draw something. All these compound movements, which he receives as a result his professional activity. It is center of the praxis. Apraxia, dysfunction of the center, causes apraxia. For example, pianist can play, but tumor in this region, he could not even don't understand in where he must press. Yeah. It is stop of the career and very dramatic. It's really, this history, some example in the history of the very famous pianist, they are known. The centers of the praxis. And in medial surface, in sulcus calcarinus here, visual center, cortical primary visual center. Primary visual center, impulses from the retina of the eye, from the rods and cones, through the optic nerve, optic chiasm, optic tract, come to the corpus geniculatum laterale and through the internal capsule to the sulcus calcarinus cells, which are located around the sulcus margin of sulcus calcarinus. And here form the primary visual images. Visual center. Olfactory center, we can distinguish smell in gyrus parahippocampalis and uncus. It is considered that test also here, but the last, according to the last data, test sensation not here. Gyrus parahippocampalis uncus test. The cortical center of the test sensation lies in inferior part of gyrus postcentralis, about here, operculum parietale, in this region. You must remember, of course, for examine 5 main. What center? What center? Sensory here, inside, upper. Auditory here, visual, olfactory, enough. And speech, also speech. And all other for the neurology. But this picture, my dears, you must, maybe on exam will not ask you, but on neurology, which will be on the 4th course after many years. If you keep this all your notes, you can use, because about 70% of neurology based on